Hello, everyone. Welcome back to the Colorado LTAP Tailgate Talk. Today we are talking about outdoor natural hazards, and here's why we're talking about it. This is the time of year when you all are out there working much more closely with nature, and you will be exposed to bee stings, tick bites, and poisonous plants like poison sumac, poison ivy, and poison oak. Um, Insect and animal bites that occur in the work environment are reportable to OSHA if they, require anything a little more than first aid or anything like that. If they lead to time off from work or restricted work activity, then they are reportable on your OSHA 300 form. Insect and animal bites, as well as poisonous plants, can have serious health effects on people, depending on where depending on allergic reaction, first of all, and then where the insect or animal bite occurs on the body or the exposure to hazardous plants. So let's take a look at a couple of these up close. Right, here's a close-up comparison of a bee and a wasp, so you'll know whether you're dealing with bees or wasps. And there's one major difference that you need to know about, and I'll tell you that at the end. But first of all, bees over here on the left side of your screen have hairier bodies because they need to collect and carry pollen. So they've got all that hair on their bodies to do that. That makes them look chubbier and heavier, and they have much larger legs than wasps. When bees fly, they usually will look heavier and slower, and they'll fly a little bit lower. They also come in a variety of sizes, anywhere from 2 millimeters all the way up to a 39 millimeter bee. I hope I never see one because that's the biggest bee I can ever imagine, and that just sounds a little too scary for me. But bees can sting you once, and they leave the stinger behind, and you'll see that in the next photo. Let's take a look at the wasp, though, over here on the right side of the screen. They have slimmer, much more smoother bodies. They have narrow waists that allows them to curl their bodies so that they can sting you better. They tend to have longer legs than bees and thinner. They're much faster and lighter than bees because they don't have to carry or collect all that pollen, and their bodies can be more aerodynamic. Wasps will feed on other insects as well as plants and nectar and honey and things like that. That means they're omnivores, and in cases where there's no plants or nectar for them to feed on, they will actually go after caterpillars. Here's the biggest difference between a bee and a wasp. A bee can only sting you once. A wasp can sting you multiple times. When a bee stings you, it leaves the stinger behind. When a wasp stings you, it keeps the stinger, and it can keep stinging you over and over again. And here's a good picture of the bee leaving the stinger, and the venom sac, or most of the venom sac, looks like it's pulling out of the bee and it's going to be left behind. So I'm not exactly sure who volunteers to have these photos taken, but here's one of a bee after it's injected the stinger. If you do get stung and the bee leaves the stinger like that, you should try to remove it. But you'll still have the effects because the venom has already been injected into your body. Whether it's a bee or a wasp, here's what the symptoms are. Swelling and itching of the immediate area, and these are progressive, so they get worse. This is what the progress of the symptoms are if you have an allergy or if you're going to have a severe reaction. Swelling and itching of the immediate area of the sting. Swollen eyes and eyelids could occur. You could have wheezing and tightness of the chest and difficulty breathing, hoarse voice and swelling of the tongue, dizziness and drop in blood pressure. Again, the more severe, the more likely you are to experience any of these. And then you may go into shock and in really severe cases, experience unconsciousness and cardiac arrest. So to avoid bee and wasp stings, really, it's the best way to there's like not a cure. You're not going to have some magic cure that they can put something on and all your symptoms will go away. It's avoiding them. That's really preventing the sting is the best cure. So you've all heard me talk about this before, but in order to do that, you need an acute situational awareness. Um, it includes watching out for bees and wasps, as well as ticks, plants, and other vermin that you can encounter, anything that might be out there. So be aware when you're in an area where there could be nests and hives and places where bees could hide, like in eaves, outcroppings, and overhangs. Are they getting into broken branches or dead trees or things like that? Look for food sources like trash, right? Fruit trees. Maybe there's fruit dropped on the ground and is rotting down there. Berry bushes are a good place to find some types of bees. Look for bees and wasps entering and exiting areas in openings in walls and pipes and in wherever there's a small opening that a bee or a wasp could get in. If you disturb a nest or a hive and you hear that wild buzzing that's going to happen, you need to protect your face and eyes and get away from the area as soon as possible. Cover your head if you can with something, and then get yourself out of there. If at all possible, um, don't swat or make sudden movements. Try to blow away the bee or the wasp. And again, to prevent them from even wanting to come near you in the first place, don't wear any scented products at work. That includes antiperspirants, colognes, hair products, skin products, anything like that. Um, it's just going to attract them. So here's some of the effects of bee and wasp stings. And if you're allergic to any of these outdoor hazards, you must actually inform your supervisor. You really should. Your coworkers may also need to know in case you're stung and cannot react on your own if you have a severe reaction. So if you can see the stinger, try to remove it. Don't scratch it. Scratching it will only break the skin in the area and lead to infection. A sting in the eyes, nose, or throat should be seen immediately by a medical professional. Swelling in these areas can cause difficulty breathing or sight problems, and you can see the swollen eye in the photo on the left, and then the blistery skin from some type of a bite in the other photo, and then the hands, the swollen hand, you can see that that's the same person's hand. And then, in the where you see the lip, you also see the more common, what most people experience is just a little raised bump on the skin. But in some cases, it could lead to much worse. And it may not be in the area affected. Again, whether or not she was swollen, stung on the eye, she may not have been. It could just be part of the reaction. Um, so if you know you're allergic, and you probably do, you're probably carrying an EpiPen, right? And if so, you'll need to administer the EpiPen as soon as possible after a sting. So your coworker may need to assist you in administering this dose depending on where the EpiPen is located at the time you're stung and your condition when you actually reach the EpiPen, and are you able to administer it yourself. And it definitely could be a matter of life and death if you are severely allergic. And whether you're severely allergic or not, multiple stings can cause an allergic reaction, even in people who have never experienced it from a single sting. Multiple stings is just more venom being injected into your body and can elicit an allergic reaction for the first time. All right, let's switch gears and talk a little bit about Lyme disease and deer ticks, or more specifically, blackleg ticks. So there are many, many, many tick-borne diseases and illnesses out there, but we're going to focus on the one most likely to get you on the job, and that is Lyme disease and its cause. So they're deer ticks, or more formally, black leg ticks. The most common symptom of Lyme disease is that bullseye rash that you see in the photo on the arm on the left. The erythema migrans is what it's called scientifically, and that often occurs at the site of infection. It's fairly easy to recognize, but not everyone gets the rash when they become infected. Other symptoms that are very similar to COVID-19 symptoms, so you really need to have an awareness of where you've been and what you may have been exposed to when you're thinking about these symptoms, or if you experience any type of low-grade fever, body aches, joint aches, fatigue, loss of appetite, things like that. If left untreated, that's the symptoms I just described are stage 1 Lyme disease. If left untreated, they can lead to stage 2 and stage 3 symptoms, which at the extreme end can lead to different types of paralysis and nervous system disorders, as well as heart conditions. This disease, again, it's named after a town in southeastern Connecticut where the disease was prevalent and first studied, but it is everywhere. If you can find deer ticks, you can find Lyme disease. And I want to make sure you're aware that a tick must be removed by pulling the entire tick, the entire head out of the skin. Ticks embed their head under the skin to get your blood. And if you pull it out without the head attached, and it will stay attached if you just yank it out, you have to get it all. So it may take some tweezers or um, some manipulation to get the entire tick out, because you don't want to risk further infection by leaving the head in there. All right, here's a really good picture of the life cycle of life stages of a blackleg tick, and you can see it on the scale with the dime there and the size. It's extremely small, much smaller than a dog tick or any of the other common ticks out there, and you'll see those in a minute. The adult and nymph stage ticks are on the fingernail on the right, and I have to say they are very, very hard to see if you're even if you're looking for them. They actually look like a freckle on your skin. Um, Again, they're very similar, and you can see that here in this photograph. The deer tick on the left, the dog tick in the middle, the largest one, and then the lone star tick on the right, and that also carries different types of tick-borne diseases. They look very similar when they're engorged. Very, very similar. The size, though, is the difference. The deer tick is much smaller. Even if you don't get one of these diseases, nobody really wants one of these ticks on them anyway, especially when they get engorged. They're just the grossest thing to think that they've been on you. But here's how you can protect yourself from tick-borne illnesses. Again, a lot of this is like the same stuff you use to protect yourself from poison ivy or any of these other things. Wear long sleeves and pants to cover your exposed skin. Tuck them into your socks to form a barrier so that the ticks can't attach to your skin. Wear light colored clothing so that if they get on you, even if they can't get to your skin, you can still see them and brush them off. Use DEET or some type of insect repellent to keep them from getting on you in the first place. And check for ticks when you remove your clothes, and look between your fingers and in any skin folds or crevices on your body. Check your hair and your head, behind your ears, inside of your ears, on your neck, places where you have freckles particularly, and touch your skin when you're doing it because again, they look a lot like a freckle. They're so small. If you find one, remove it with tweezers, again being mindful to get the entire head out when you do that. All right, let's look at some other types of poisonous things out there or things that can get you. Poison ivy, poison sumac, and poison oak. These are the poisonous plants that are most common out there, particularly poison ivy. That's what we're going to focus on today. And that's not to say that thorny things can't get you and damage your skin. They do. But these are the kind that these poison plants will cause rashes that can actually be debilitating. Poison ivy being the most common, but sumac and oak are out there as well and typically cause the exact same symptoms. So we'll focus on poison ivy as um, most people are most familiar with it. It is a vine. Poison ivy is a vine. This is what it looks like. This was a beautiful picture of what poison ivy looks like in the East Coast anyway, along the Northeast. It grows along fences, walls, poles, trees, and it can be ground cover. It can just be anywhere. If you've ever traveled throughout New England, you've seen it. It is the state plant for all 6 states in New England. It can cover almost any outdoor surface in most parts of the U.S., but it likes the moist, warm places the best. It is out here in parts of Colorado. I've seen it, but it is certainly not as prevalent as it is in other parts of the country. But you can easily see in this photograph the leaves of 3 on one stem and then the mitten-shaped look of each of the leaves. This is another photo, and these leaves give off an oily substance that carries the urushiol oil that causes the irritating rash. Um, and I only use this picture because it shows the shiny surface. It doesn't have the mitten-shaped leaves as well, but this is still poison ivy, and it still does have that urushiol oil in it. Um, but that oil causes people to react differently. Some very, very severely, while others can get it on them and be so exposed to it, but have absolutely no symptom. But it's not just in the leaves. The oil is actually in the stem and in the vine. So be aware when the leaves fall off, the entire plant is still poisonous. And sometimes, like I said, the leaves will look shiny. Other times they look dull. They are equally as poisonous. The oil can get in your skin and on your clothing and be carried or spread easily if you've been cutting or clearing plants and brush. Even the smallest little bit can just get on you, and if you're sweating, can just spread everywhere. So here's what the rash looks like. Once the oil penetrates the skin, it can happen within minutes, and redness and swelling can occur or become worse within 24 to 72 hours. Some of us, have severe reactions and notice it right away. Others does take time. And even if, like somebody like me who does have a severe reaction, sometimes depending on the exposure, can take days to actually show up. It looks like a line sometimes where the plant has actually dragged across your skin. You can see that in the first photo up in the left corner. But it may also break out any place that the oil comes in contact with your skin, including between your fingers, around your neck and face, eyes, anywhere. It can be generalized blistery red rash like the one in the finger that's on the bottom picture. Causes scratching actually causes the skin to break again, and your risk of infection, just like a bee sting or any of those other things. Um, Prevention is the best treatment since there's no cure for poison ivy exposure. Again, the same um, types of prevention you would get for almost anything else out there. Wash with soap and water and clean the affected area as soon as possible. Don't scratch. Use some type of Benadryl or antihistamine like Atarax to control the itch. Mild cases, you can soothe the itch a little bit and some of the symptoms with a Rulagel or calamine lotion. That's probably familiar to most people with treating poison ivy, but there's nothing that's going to take it away. Um, it's going to stay there. It's just got to run its course. If you get a really severe case, like I did when I was exposed to it burning, you can be put on different types of steroids. All right, so what can you do to prevent contact with poisonous plants? You can wear long sleeves, long pants. Again, these are the same types of things you're doing to protect against ticks and tick-borne diseases, so you're getting more bang for your buck. This should be your regular summer uniform when you're out there. Long sleeves, long pants, boots, gloves, preferably gloves that form a seal around your sleeves. Wash any exposed clothing after you've used it separately in hot water with detergent. Again, those oils will stay out there and have been known to remain on objects for it says here 5 years, but I've seen studies where they've been on objects for thousands of years that have been dug up. So wash it in separately in hot water away from your other clothes. Use some of those barrier skin creams, Second Skin, whatever's out there. There's all types of different things. But again, if you're going to use them, wash them off and reapply them at least twice a day while you're out there. After you've used tools, clean them with alcohol, isopropanol or isopropyl alcohol, soap and water, whatever you've got. Again, that oil can remain active on the surface. It says here 5 years, but those studies show it's been longer. Wear disposable gloves during this process and don't burn the plants. If you're doing brush burning, because poison ivy, poison oak, or poison sumac will the irritants will get into the smoke and can cause severe allergic and respiratory problems in anybody that's exposed to that. And that's not a fun place to be. All right. So the key points to remember today are poisonous plants and insects are everywhere, and you are all at risk. People are affected differently by exposure to insect bites and poisonous plants. You need to know how some of these things are affecting you, or you should know by this point how some of those things affect you. And if possible, if you have a severe allergic reaction to any of them, share that information with your supervisor and your um, fellow employees. Identification and prevention are the key to reducing your risk. There's no cure for either of these. Whatever effects happen, they're going to have to run their course. It's just a matter of staying safe and doing whatever you can, having that situational awareness to prevent the exposure. So the references for the material I used today were from the CDC and their topics for plants and recommendations, the OSHA.gov site for working outdoors, and the NLTAPA list of tailgate talks. Thank you all for coming today and taking part in the Colorado LTAP Tailgate Talk. I hope you found it useful and that you're able to incorporate some of this information into your daily work routine. Our workspaces are hazardous areas, and the more knowledge we have of the things we're exposed to, the better we can protect ourselves. So stay safe, and I'll see you guys out there next time.